Hello, Dr. Vikki Petersen here. I wanted to speak with you today about an interesting case that was just published in Gastrointestinal Medicine just a couple of weeks ago, actually, middle of September. And the title's a bit long, so I'm going to look down as I read it to you. It was entitled Onset of Enhanced Intestinal Permeability and Food Sensitivities Triggered by Medication Used in Dental Procedures. So what happened was a very healthy 52-year-old woman started a very rigorous dental program. She had a root canal, she had a bone graft, and then she also had implants in her teeth. Implants, especially if you're doing the whole mouth, can take many, many months. It all began with 5 different visits that occurred over 10 days. It involved pain medication, it involved antibiotics, and obviously a bit of stress. I know many of us can think about going to the dentist for getting a root canal, and one day would be plenty, let alone 5 visits in 10 days, and then repeated visits over the next several months. After her last visit, and this whole time frame was about 4 months, she actually had a severe allergic reaction. So severe she was having trouble breathing. They needed to use emergency medication. She got past that, but it definitely was a severe stress on her system. And then within 2 weeks she had diarrhea, she had abdominal pain. She basically turned on IBS-like symptoms. They evaluated her for Crohn's disease. They evaluated her for celiac disease. All these were negative and basically told to go on her way. Fortunately, she found a functional medicine doctor who used testing that is more sensitive, like we use here, found out she was gluten sensitive, found out she had a leaky gut, and she was obviously very sensitive to gluten. Some other foods came up as well. But here's my point. We know that the onset of celiac disease, for sure, possibly gluten sensitivity as well, certainly that was the case for this woman, can come on as a result of some sort of trauma to the body. A woman can have a baby, someone can have a surgery, a severe infection, something that is enough to sort of flip on that gene that is programming you for celiac and likely gluten sensitivity as well. Different genes, but same mechanism. Where the body is healthy enough, it can keep that bad gene turned off, then it goes through some sort of trauma and the gene turns on. So my point in talking about this case was kind of twofold. One, certainly as a healthy person, I think it's important when you know you're going to go through an event like this, and it's an elective event. She certainly chose to get the dental implants when she did, that it would very much behoove everyone and much kinder to the body to kind of prep oneself, especially when you have the ability to have it scheduled. It's not an emergency kind of thing, and you can just really boost your immune system, put yourself through a program that will enhance your probiotics, enhance the structure and integrity of the small intestine, and these are programs we do here. Other functional medicine practitioners can do them as well, but if you really kind of Teflon coat your immune system, then the likelihood of that sort of stressor turning on a disease is much, much less. Also consider, if you're having to go through something and it's elective, stretching it out a little bit. I mean, maybe those 5 visits in 10 days was a bit much. Maybe she could have done, 2 a week instead of 3 or 4 visits a week, because it was a lot of impact on her system, a lot of medication. And granted, this is hindsight for her, but it's not hindsight for the rest of us. And those of us who don't enjoy optimal health the way this woman did, certainly if you have an elective procedure coming up, maybe a hip replacement or a knee replacement or something dental, something that's elective, you're scheduling it, you're planning it. Take that time, take 4 to 6 months ahead of those procedures and really do everything you can to boost your immune system and enhance the structural integrity of your small intestine so that you can weather this procedure in a healthful fashion versus actually having a disease initiate as a result. And I keep harping on the immune system in the small intestine because it's the immune system that keeps those bad genes under control, and where is most of the immune system housed? In your small intestine. So just a heads up, I found the case very interesting and I thought it was worth discussing. So please send me your comments, your questions, let me know how you're doing. I love to hear from you. And until next time, I wish you very good health.